Welcome to this week's edition of New York Now. I'm Dan Clark. The controversy over the Cuomo administration's handling of nursing homes during the pandemic snowballed this week. Things are not looking good. So let's get right into it with John Campbell from the USA Today Network. John, thanks so much.
Hey, thank you for having me.
Things have really escalated in this situation. We just found out on Wednesday that federal prosecutors in Brooklyn are now looking at the governor and his handling of nursing homes. What do we know about that?
Well, we learned about that from the Albany Times-Union, which reported that the U.S. Attorney's Office in Brooklyn and the FBI in Brooklyn is involved in some sort of investigation into the governor's coronavirus task force, which generally is senior staff members, and there were some folks from Department of Health as well. And we don't know a whole lot more than that, other than it is touching, in part at least, on the nursing home situation. And we've seen that really blow up in the last few weeks after really had been simmering for months and months and months, where the Cuomo administration had not been revealing the number of residents who had contracted COVID-19 and died in hospitals rather than in the homes themselves. We finally got that number after the Attorney General put out a report, and now we've seen this really blow up with a comment in a private session by Melissa DeRosa, the governor's top aide, who suggested that they held back releasing that number and other data after getting a DOJ letter back in September, or late August, I should say.
So this has all resulted in some very tense moments between the governor and the legislature. I understand that Democrats in the state Senate, at least, are going to move next week to limit the governor's emergency powers as a result of all of this. What do we know about that? What does it look like? And do we know if the assembly's on board?
So since March, the governor has had these extraordinary powers during this state of emergency where he's been allowed to unilaterally impose restrictions, curfews for restaurants and bars, non-essential business shutdowns, those types of things, because the legislature gave him that power in the very early days of the pandemic. Now, in large part because of this nursing home fiasco, the legislature is pushing back and suggesting that they want to rescind or curtail his powers. So the proposal that we're hearing about in the Senate, that the Senate's apparently going to vote on as early as next week, would create a panel of lawmakers that would have to approve these restrictions before they take effect. Anything that any directive that the governor puts out under these powers would need approval by this. We haven't heard the governor speak about this yet, but we can be sure that he doesn't like it. He's spoken repeatedly about the need to act fast and unilaterally to put into place these restrictions and take them away.
Right, and under his emergency powers right now, there is a provision where the legislature can repeal any of his executive orders or directives within 10 days of that happening. So all this just feels kind of very political to me. Why don't they just use that option instead?
Well, I think there's definitely a sense among lawmakers that they want to send a message, that they are not pleased. And Republicans have been beating this drum for months and months and months, and now you've really seen the Democrats come on board since the release of the Attorney General's report, since Melissa DeRosa's comments.
Yeah, it's just there's a lot going on in this situation, and I wish that we could just talk about all of it, but we do have full coverage over on our website at nynow.org. You can go there anytime and read all of it. And John from the USA Today Network also has fantastic coverage literally all the time about nursing homes, one of the reporters in the briefings during the spring and whenever they ended in June. So John will be watching it. Thank you so much for coming out here.
Thank you for having me, Dan.
So we're going to move on from nursing homes for the week in just a minute. But first, some say this whole situation has exposed problems that already existed at nursing homes before the pandemic. In a report last month, the state AG's office said some nursing homes are understaffed and don't always do enough to prevent the spread of disease. And that has some calling for changes at nursing homes and a closer look at alternatives. Denise Figueroa is the executive director of the Independent Living Center of the Hudson Valley. Denise, thanks so much for being here.
Thank you for having me.
So you're part of a group that tries to promote independence from nursing homes. In other words, you're saying it doesn't have to be the default option for people to live in a nursing home when they're aging. And part of that, your argument, is that the conditions at nursing homes aren't always the safest for their residents. Tell me what you mean.
Yes. Independent living centers have promoted the idea of living in the community ever since we started 40 years ago. The truth is that nursing home settings, institutional settings, group home settings, very often when you've got large groups of people together, they're not as safe because disease does transmit more easily, you don't always have the attention that people assume you have in a nursing home. You know, the staffing is never adequate to be able to meet the needs of that many people. And most of them are for-profit organizations that are looking to make sure that they make money at the end, and therefore don't always invest in the staff and the personnel that it takes to keep people safe.
So we now know that more than 15,000 people at adult care facilities died from COVID-19 in the past year, and there's a lot of disagreement over why that happened. So I'm wondering, from your perspective, do you think it was more of the fault of the state and its decisions, or do you think that this is part of a broader pattern of nursing homes maybe not being prepared for some sort of infectious disease like this?
Yeah, they certainly weren't prepared for it. You know, I think there's going to be blame all around in terms of, you know, whether or not putting people back into nursing homes once they tested positive created more of a spread. That's up to other people to decide. But the truth of the matter is that what COVID-19 did is just shed light on an already dangerous situation. People live a shorter lifespan when they live in a nursing home. That is just the bottom line, and the statistics can prove that. We live a longer, happier life in the community, and we're much safer in the community when we can bring people into our own home to take care of us, as long as we are aware of the services that are out there. And that's so much of what the independent living centers have been doing and focusing on for many years.
So talk to me about independent living centers, because I feel like people watching may not know that there's a difference between a nursing home and an independent living center, and it's actually quite a big difference.
Okay. Yes, independent living centers are organizations that are run by and for people with disabilities. So the majority of our board and staff are people with disabilities. And what we do is try to link people up with the community services that are available, whether it's accessible housing, information on benefits, being able to help people apply for benefits, link people up with services that they need in order to live independently in the community. Independent living centers are about making your own choices, self-determination, and not allowing other people and other systems to control your life.
Can I ask, why not just make nursing homes safer? Why not just improve the conditions at nursing homes, maybe create some safer staffing levels? What's the advantage of choosing an independent living center over a nursing home?
Well, there may be some people who need a nursing home, and yes, the conditions need to improve. But I don't think the answer to this is to grow a better, bigger nursing home to accommodate people. The truth is that we all have something to offer our community, and by being a part of our community, people with disabilities and senior citizens have a lot to offer and can continue to be that integrated part of that community. And when you end up in nursing facilities or group home situations, you may not necessarily be able to participate or be a full part of that fabric of the community.
So we know from the State Attorney General's report that some nursing homes are understaffed. The conditions are not so great all the time. And on the flip side of this, as you and I were saying, there's also this incentive for for-profit nursing homes to make money. So they may cut some services for people to make some extra money. And I'm wondering, from your perspective, do you think that's on the nursing homes to fix, or do you think it's more on the state?
I think the state government certainly needs to be monitoring what's going on in those facilities. That is their role to do. I think that the fact that there's a for-profit factor involved here really is a disincentive to providing the best care, and it makes the situation very dangerous. So there's certainly a role for both to play, and you know, I think that taking the for-profit model out of it would probably be a first step, frankly.
All right, well, we will be taking a look at them. I think it's a really interesting idea. Denise Figueroa from the Independent Living Center of the Hudson Valley, thanks so much for being here.
Thanks so much. Have a good day.